Good evening, everyone. I'm Beth Sanborn, moderator for Meet the Candidates for State Senate District 30. We'd like to welcome the public to this event and thank everyone for their interest. Maine and the nation will be voting on November 6th, and State Senate District 30 covers Gorham and parts of Scarborough. Tonight, we give the public an opportunity to hear the candidates share their vision on a variety of topics. This program is a forum, not a debate, so the candidates have been provided with questions prior to the broadcast, and we will be rotating the order in which they respond to those questions. In the municipal chambers tonight, we have incumbent Senator Amy Volk and her challenger, Dr. Linda Sanborn. Candidates, welcome and thank you for joining us. And just to avoid any potential perceptions of conflict of interest, despite our common last name, Dr. Sanborn and I are not related. Just wanted to make that statement. We offer our participants an opportunity to start the evening off with their opening comments, and it was decided that Linda will go first.
Okay, thank you. Good evening, everyone. I want to first thank both Georgia and Beth for making this evening possible. I think that it is always important for voters to hear directly from the candidates, and I appreciate this opportunity to share my thoughts with you. So I live here in Gorham with my husband, Jeff, who grew up on a dairy farm out on Fort Hill Road. I have 3 grown sons, and one of them lives here in Gorham with his fiance and my first and only grandchild so far. I love this close-knit community, and I love the way that neighbors here really care about their neighbors. I have had the great privilege of practicing family medicine in Gorham for 25 years. It's been a lot of fun knocking on doors and meeting old patients, some of whom I delivered, coworkers, and a whole lot of new people as well. When I retired from medicine, my goal was to be the best grandmother ever. And the problem was there were no grandchildren on the horizon. So I was asked to run for the legislature, and I think making the decision to run was one of the best choices that I've made in my life. I've had the great honor of representing part of Gorham and part of Buxton for 4 terms in the Maine House, and I served on both the Health and Human Services and Appropriations committees when I was there. I have to say it was somewhat sad when I termed out, but it was also to get good to get reacquainted with my husband, as we had gone different directions for so many years. I never planned on running again, and to be completely honest, I was pretty happy in retirement. But I've been so frustrated, and it's been so hard to watch what's been going on in Augusta and across the country. We've started to lose respect for the legislative process, for the balance of powers, for those who see issues through a different lens, and for showing compassion towards one another, and I fear for democracy itself. So I felt compelled to step up and run for the Senate, and I appreciate the chance to run, and I appreciate the chance to be heard. Thank you.
Thank you. Amy.
Good evening, and thank you for having me. And thank you to Dr. Sanborn for being here as well and for running a very positive campaign. This campaign has been very civil, and I think it's exactly the way voters would prefer that things would be, especially when it comes to local candidates. So Senator Amy Volk, I've been the state senator for Gorham, Scarborough, and Buxton for the last 4 years. Before that, I served 2 terms in the House representing part of Scarborough. I have 4 children, 3 of whom are now adults. One is in college, and the other 2, well, one is in law school, her last year of law school, and then we have our oldest child who is now living out in Los Angeles. We also have still at home with us a daughter who is a freshman in high school. And I'm the assistant majority leader in the state Senate, and in addition to that, I chair the Labor, Commerce, Research, and Economic Development Committee. It's a committee that I really and truly love. I've served there for the last 8 years, 4 years as chair, 2 years as lead, and then my freshman term. And I also serve on the State Workforce Board, the Maine Children's Growth Council, and the Child Care Advisory Council. Maine is really important to me. I've lived here my entire life. My family goes back many, many generations in the state of Maine. And the biggest concern that I have is the fact that we are exporting so many of our most precious resource, and that would be our kids. And so my biggest passion is making sure that Maine is a place that all of our kids will want to call home, not only through high school graduation, but throughout college and then on into their career life and raising families. So that is what I have worked very hard on. When you are the oldest state in the country, it's not cliche to say that children are our most precious resource. And so in order to better protect children, I've passed such legislation as identifying lower lead levels in blood, so that kids are more quickly identified if they're living in an environment that's been contaminated. Not only did we lower that, but we also found the funding. And then I worked again to help a Democrat colleague of mine find funding yet again to clean up more contaminated housing. I've also worked with stakeholders who are home child care providers to make sure that people are able to go to work, because if you don't have a flexible, affordable, safe place to bring your kids while you're at work, you can't work. And employers in Maine are already struggling to find workers. So this is a passion of mine. My legislation is diverse. I would encourage anyone who's interested in looking at my record to go onto the legislative website and actually look at the bills that I've passed, the bills that I've sponsored, and you can also look at my website as well, and we'll have more details about that at the end.
Thank you. So we're actually going to start with the subject of housing this evening. So there is a notable lack of affordable housing throughout the state of Maine. And we'd ask that, citing specific details, please provide 2 ideas or proposals you might have for generating more affordable housing. And Amy, we'll start with you for this question.
Sure, thank you. This is a subject that we deal with a lot in my committee. So the Labor, Commerce, Research, and Economic Development Committee, as I said, is really diverse. And one of the areas of oversight that we have is Maine State Housing Authority. And 8 years ago, Maine State Housing Authority was having a lot of problems. There was a lot of rampant spending and a lot of cleanup and abuse that was happening. So we have since reined all of that in, and a couple of the ideas that I have been that I have sponsored the senior housing bond. I was also a major advocate for that. In this second session of the legislature, we actually changed it a little bit, and we added workforce housing into that, as well as we were going to put some funding in for lead cleanup, which is, again, another issue. So unfortunately, that was not one of the bonds that got approved by the legislature. So bonding would be one area that we could use to fund affordable housing. But the other would probably be some sort of a tax credit, and I also sponsored a bill that established a tax credit for construction companies that build affordable housing. So this is definitely an area that we need to continue to work at. It's good to know that Maine's actually not alone in this. I just actually read an article today about this being a nationwide issue. So it's something that perhaps the federal government needs to begin to pursue a little more proactively as well.
Thank you. Linda, your thoughts on affordable housing in the state of Maine?
Yes, thank you. Well, I would go first to bonding as well, and the very first step is for the governor to release the bonds that the people passed a year or two ago. You know, the people voted for $15 million to at least start the process of building affordable housing for our seniors, and that money is still not out there and available to use. We really need much more than that. We need more like 60 million, but at least that 15 million is a good start. The second idea that I think is really important for people to know about is what is called housing first. So many people who are homeless suffer from mental illness. They suffer from opiate addictions, or they may have just run into a lot of bad luck, lost their jobs in the recession, and not have the right training to get another job to be able to be out there and work, and they're in a really bad place. And we know that if people don't have stable housing, they really are not able to get ahead. It's very hard to treat mental illness when you don't have a stable place to call home. Same thing with opioid addiction. And when we talk about people getting a job, if they don't have a home address, it's very hard for them to get a job when they're not employed. So I think that we need to approach the whole idea of affordable housing from that housing first, and understand the great importance that affordable housing makes. I also know that when I was on the Appropriations Committee, that there were funds that were set aside for housing, like the Home Fund. And this is a fund that, unfortunately, the money that is in there, once it built up to a certain amount, if the legislature was short on some area of the other area of the budget, they would swipe those home funds rather than using them for the purpose that they were meant for. So I think using the funds as they were meant to be spent is an important point.
Thank you. Moving on to the subject of clean elections, the Maine Clean Election Act established a voluntary program of full public financing of political campaigns for candidates running for governor, state senator, and state representative. What do you think of the program, and have you used it? Linda, we'll start with you this time.
Okay. Yes, I'm a huge fan of the clean election system. I've always run as a clean election candidate, all 4 of my House campaigns, and currently with my Senate campaign. I think that allowing people without personal wealth, or who don't have connections with the big donors, makes it so that anyone can run, and this is a really important thing in our democracy, that anyone should be able to run in an election and be able to run a good campaign, a strong campaign with adequate funding. So I'm proud to be a clean election candidate in a system that was voted in, approved by the voters, and supported by Maine people.
Thank you. Amy.
Sure. So the first time that I ran for office, I was a clean elections candidate, and I did find it was very helpful. I don't think I probably would have run if I had to raise money. That prospect just was very, very intimidating. However, after my first term, I felt like I had had enough success that I had a record to go out and ask people to support me, and I was comfortable doing that. So I have mixed feelings about it. Voters approved it, so I think it's fine. I don't think we should kid ourselves and believe that it's gotten the money out of politics, or the influence of money that money plays in campaigns. I think we all remember the first time that I ran, which was 4 years ago, and the independent expenditures that were spent on the campaign for Senator Boyle were in excess of $250,000, and compared to $60,000 that was spent on my campaign. So I think there's still that influence there. I think it's a major challenge to try to eliminate that because of freedom of speech.
Okay. Staying on this subject for the next question as well, but just a caution that the next response is capped at 1 minute instead of 2.
Okay.
Yeah. So starting with Amy this time, do you think it was appropriate that the clean election funds were actually held back in this election cycle?
No, it wasn't appropriate. They were approved by the legislature, and the governor should have dispersed those funds.
Thank you. Lynn.
Short.
Yeah, I agree. It is not appropriate for the governor to hold back funds that were sitting there ready to be spent for a particular purpose as the legislature appropriated them. I also think that it's disappointing that legislators openly admitted that they had known about an error in the budget bill and chose to hold that information up in order to either hurt or help certain candidates, and I think that was a very bad choice.
Thank you. So let's move on to the subject of Medicaid, which has been a hot button topic for probably as long as any of us can remember, specifically Medicaid expansion. And we're back to 2-minute responses, by the way, for this question. And
That's good.
Just to clarify, probably needed. So both houses of the Maine legislature voted to approve funding to extend Medicaid to an estimated 70,000 Maine residents. Maine voters approved expanding Medicaid by a margin of 59% to 41%. So starting with really more of a conceptual question, is adequate health care a right for every citizen? Why or why not? And Linda, actually, sorry, we'll start with you this time.
Thank you. Yes, I believe that health care is a basic human right that every person deserves. As a doctor, I really know how that plays out in the office when people need access to care and are unable to get it. It makes me think of a particular patient that I had who I delivered her 2 sons. I'll never forget her because her first son tragically died with sudden infant death syndrome. But she also had many other chronic medical problems, and one of those was severe asthma. She did work, but she worked in a low-paying factory job where she didn't have benefits. And she would call me with a severe exacerbation of her asthma, and you could tell how severe it was because she couldn't even complete full sentences because she was so short of breath. And I would tell her she needed to come in, I needed to see her, and more than one time she had told me, I can't afford to come in. I think this is just morally wrong. You know, I would see her anyway and just say, come because you need the care, but we need a system that provides health care for everyone and doesn't choose who's deserving or undeserving of care.
Thank you. Amy, your response.
Sure. So I do believe that everyone deserves health care, and I think in this country, obviously Dr. Sanborn played a really important role in this community in terms of providing health care, but we also have seen a lot of free clinics that have come out as a result of the Affordable Care Act, federally qualified health centers, and we also have hospitals that give free care. They have free care programs and sliding scale programs. And so I certainly think that there are a lot of opportunities for people to have health care. I would like to see a better emphasis on preventative health care and healthy lifestyles.
Thank you. Staying on the subject for the following question, this response, though, capped at 1 minute. Did you or would you have voted for the expansion? Amy, we'll start with you.
Sure. So I actually voted against Medicaid expansion. I think it was probably 5 separate times. But once voters in this district approved Medicaid expansion by a fairly decisive margin, I decided that I really had a responsibility to vote for it. And so given the opportunity this time around in the legislature, I did support it. In fact, after Medicaid expansion passed by referendum, I went to work and did a lot of reading on the issue, and I read a lot about a lot of the conservative states that have implemented Medicaid expansion and how they've done that, and some of the principles of personal responsibility that they've worked into that. And so I actually arrived back at the legislature with a lot of ideas, ready to work on this issue, and I completely expected us to do that work. Unfortunately, there didn't seem to be the willingness to find the funding. And so, unfortunately, it didn't happen, and it still hasn't happened, but I am certainly willing to look at that. Indiana, for example, has some really interesting programs that they're using for Medicaid expansion, and I think there's just a lot to learn. We have the benefit of having other states now to look at, and we can model ourselves after them.
Thank you. And Linda, your response.
Yeah, I not only voted for Medicaid expansion all 5 times that it came up, but I sponsored the very first Medicaid expansion bill, and I worked really hard on every version of Medicaid expansion that came through the legislature to try to have the state take up this important program that provides health care for more than 70,000 people. You know, I wanted to pay off the hospitals and pass expansion because so many of our rural hospitals, a huge number of their clients are on Medicaid, and they're threatened. Their financial ability to continue to stay in business is threatened by the fact that we haven't expanded Medicaid. I'm glad that Senator Volk did vote to fund Medicaid expansion this last time around, but Amy did vote against it all 5 times, and I think that we need more consistent leadership in this area.
Thank you. Staying on the subject, and again for this question, it'll be a 1-minute response. What are your thoughts then on how the state will or would provide their portion of the funding for Medicaid expansion? Linda, we'll start with you this time.
Well, I think this past session, the state showed that we do have the resources. We have the money right now, and there really isn't an issue about how we're going to fund it initially. Once expansion happens, what we know is that it's going to bring $525 million a year of new federal funds into the state economy. We know that we'll save $27 million in the correction system because of the way Medicaid expansion will help people who are in the jails. When they go into the hospital, we pay for their hospital care completely with state dollars. Also, by providing care for people who have opiate addictions, we'll keep people from needing to go back into our jail system. So there's a lot of savings that can be accomplished. And then it will create 6,000 new jobs. So there will be a multiplier effect from all of the new federal funds that will generate new revenue for Maine. And in that way, we can afford to do it. The money will be there.
Thank you. And Amy, your thoughts on funding the actual expansion?
Sure. So the funding piece is really the sticky wicket. And the reason that I did not support, and I stated from the beginning, the reason that I could not support Medicaid expansion before it was passed by referendum was that Maine was, in a very real sense, being penalized for our previous generosity. So Maine essentially expanded Medicaid before it was cool to expand Medicaid. And so we were covering able-bodied young adults prior to this administration. And then this administration rolled back those benefits and said, you know, you can work, you can hopefully qualify for insurance through an employer, and now people can qualify through the federal exchange. And so those people are no longer able to get Medicaid. So when you expand Medicaid, they're suddenly eligible again, but Maine does not get the same match that other states get for those young adults. We go back to the I think it's the low 60% match rather than the 90%. So that's part of why it's a little bit of a raw deal for Maine, and my feeling all along was that we needed to negotiate with the federal government and not be penalized for having been generous. I do agree with Linda that there probably are some savings that we could get and that we could identify in the next administration in terms of trimming those costs. But we do have to be careful not to run up the debt that we had before. We had, don't forget, we owed the hospitals $250 million when Governor LePage came into office, and that was a major problem for our hospitals. So I think we need to be very careful about that.
That's time, sorry.
One last thing, we can equalize the tax on non-tobacco smoking products, and that might be a small source of revenue, probably fairly minor, but would help.
Linda, if there's any detail you'd like to add to your response, since there was a little extra time given to Amy, if you had anything you wanted to add in 15 or 20 seconds, you're welcome to.
I'll save it. I might talk longer on another.
Okay, thank you. And finally, 2 minutes on the next question, still on Medicaid expansion. When we talk about the Medicaid expansion in the state of Maine, how, if at all, would you improve that process, improve the actual expansion? Amy, we'll start with you this time.
Sure. So earlier I mentioned Indiana. One of the things that Indiana is doing is work requirements. And I think that just in general, we need more personal responsibility. So managed care, for sure, for Medicaid clients would be really good. Preventative care, so that patients would definitely have a medical home with a doctor, somehow ensuring that they are incentivized for healthy lifestyles would be really helpful, I think. Copays, I think, is something that we should certainly look at and consider. And I believe there's even in, it could be Indiana or it might be another state, they're allowing Medicaid dollars to somehow be used to purchase private insurance through the Federal Healthcare Exchange. And so that's something that we should also consider looking at, so that we can have a little bit of a hybrid. And that also works really well for our providers, because they receive a higher reimbursement rate than they do for Medicaid patients.
Thank you. Linda.
Yeah, I think that the best way to improve it is to reject the ideas that are being floated that would make it harder for people to access the health care they need. And work requirements are one of those things that we absolutely need to reject. They don't work. They actually will cost the state more money. If you understand that more than 60% of people are either working, or they at least have one member of the household that is working, and if they're not working, it's often because they're taking care of someone else who is disabled, or taking care of young children, or they themselves have a disability. I really object to this term able-bodied, because I think it ignores the fact that there are disabilities that you don't see, and I think that it is wrong to judge a person by their looks and what you think they can do, rather than walking in their shoes and knowing what it is that they really can. So I think that what work requirements do is just add to the bureaucratic obstacles that keep people from being able to get the health care coverage they need. It's just a way to cut people off of Medicaid or health care, and I think that we need to provide more health care, not less.
Thank you. Moving on to the subject of political funding, and it's something that we've talked briefly about before this evening. Do you think there is too much outside political funding coming into the state of Maine? If yes, what do you propose be done about that? And if not, your justification for allowing the current level of outside political funding? Linda, we'll start with you this time.
Yes, I think there is too much outside money that comes into our campaigns. I don't really view this as a right versus left issue so much as a right versus wrong issue. I think that Citizens United was a very bad decision, and it's difficult for states to make sure that outside money cannot have an outsized impact on our elections. At the national level, I think that we need to overturn Citizens United. Treating corporations and super PACs as individuals just makes sense to people who either benefit from those super PACs or are corporations that benefit. Here in Maine, I'll continue to advocate for clean elections and for more transparency.
Thank you. Amy.
Sure. I would agree that transparency really is key, and I've supported legislation that has increased that transparency for ads, so that it has to say who is paying for it. The problem is that a lot of times the organizations sound really rosy, but it's, in a sense, it's money laundering. So those organizations have received the money, that's coming from all these other sources, and then they put on a rosy-sounding name. And so it's really a challenge to try to crack down on this. Maine, I think, has been a leader, actually, in trying to make our campaigns more transparent. But unfortunately, the dark money just continues to flow in at record levels. And, I would certainly be happy to consider any ideas that anybody had to try to eliminate it, but it's a big challenge.
Thank you. Moving on to a separate and very tense subject, the thoughts of gun control and some of the safety issues that we've been seeing. Thus far, the state of Maine has not experienced a mass shooting in a school or anywhere in the public sector. Are Maine gun laws adequate, or do you see a need to do more to ensure public safety? Amy, we'll start with you.
Sure. So Maine is actually considered one of the most safe states in the country, and thank God we haven't had a mass shooting or anything even close to that. I think for the most part our current gun laws are quite adequate, and that's evidenced by the safety that we enjoy here in our state. So one of the things that we did after the shooting in Parkland, Florida, was we added $20 million to the school construction funding, and that money is intended for schools to make safety improvements structurally on their schools, and they can qualify for those state grants. And I also supported increased access to mental health services. I supported a bill that didn't pass, but it's known as a red flag bill, and that was sponsored by Senator Dion. And that basically would allow a family member to alert law enforcement of someone being mentally unstable and having access to firearms, and it would allow the law enforcement to take possession of those firearms for a short period of time until they could hold a hearing and determine whether or not that person should get those firearms back. I felt that that made sense. I think this is a very this district is a very common sense gun law district. You know, I have consistently not gotten a top rating from the NRA, despite the fact that I'm a Republican, and I've had a lot of other Republicans around the state question me on that, and I feel it really reflects my district.
Thank you. Linda.
I don't believe that our gun laws are adequate, and I think that this is such an important issue that we can't afford to wait to act. Really, gun violence is a public health issue, and I think that we need to approach it as that. We need to be allowed to gather the data and study the issue so that we know what the best way to prevent gun violence is. And unfortunately, the NRA is such a strong lobby, and so many congressional leaders are beholding to them that, you know, they're not willing to change the law and allow us to address it in a way that I think would be most helpful. When we had a rise in automobile deaths, when we had many more cars on the road and going at faster speeds, we studied that. We determined that safety belts were something that really prevented deaths, and I think that we could do that same sort of thing with gun violence as well, to figure out what would be the best way to proceed. Saying that, we also do have some good evidence that gun laws do help. And I look at some data from the state of Connecticut after their school shootings, when they made universal background checks a law. They actually had 40% less gun violence because of that. The state of Missouri did just the opposite and relaxed their gun laws and had a 25% increase in gun violence. So I believe in data, I believe in science. I think we need to apply that to gun violence to figure out what it is that we really need to do.
Thank you. And staying on the subject for another question and a 1-minute response for this next question. Do you approve of constitutional carry, which is part of Maine legislation? Linda, we'll start with you.
Well, probably not unsurprisingly, no. I don't support constitutional carry. I think that if we want to drive a car in Maine, we have to get a license, which takes so many hours of study and training and so many hours in the car with a licensed instructor. We have to license our dog every year so that they are not going to spread rabies. I think in the same way, for something as important as carrying a weapon in public, that it just is common sense that we also have some sort of training required or some sort of licensing required to carry a gun in public.
Thank you. Amy, your thoughts on constitutional carry?
Sure. So I did vote for a constitutional carry, but I actually voted against it first. And the reason that I voted against it initially was because I had grave concerns about people who didn't understand all of the responsibility that carrying a gun entails, getting themselves into trouble and putting themselves into an unsafe situation, or others, obviously, into an unsafe situation. So I actually got an amendment passed when we passed constitutional carry that, number one, the state police posted Maine's carry laws on their website so that it's easily accessible to the public. And number two, that when you purchase a handgun now at a dealer, they are supposed to give you information on gun safety, on the law, and make you sign off acknowledging your need to understand that information before you go and carry a gun. So I felt that that was very important. That was my way of influencing what I was not completely comfortable with. And I do want to point out that the two safest states in the United States in terms of gun violence are Maine and Vermont, both of which have constitutional carry. And that's been unchanged in 3 years since we've had it.
Moving on to another subject, citizen initiatives. And this next question, a 1-minute response, please. Do you approve of the way the governor delayed or challenged the implementation of several citizen initiatives? Amy, we'll let you lead off here.
No, I don't agree with it. I think that once a bill has been passed by referendum, then it really is incumbent upon the legislature to get to work on that. 70% of bills passed by referendum actually do end up being amended by the legislature, so it's not at all unusual that we would have to dig in and make some changes. The marijuana referendum was particularly a mess, and it took us 2 years essentially to get that worked out. We did finally get it worked out, and I'm glad to say that we were able to even override a veto to do that.
Thank you. Linda?
No, I don't think that it was right for the governor to delay or challenge implementation. Medicaid expansion is the perfect example of that. We still are not using the law that is in place because he won't allow it to be implemented. I think that the citizens' initiatives are working the way they're supposed to. I learned in 8th grade civics that it's the governor's job to enforce the law. It's the legislature's job to make the law. So basically, the governor is not doing his job.
Thank you. Staying on the same subject, but a 2-minute response for the next question. Do you believe that perhaps there should be stricter requirements for future citizen initiatives, maybe requiring more signatures or some other method? But why or why not might there be a need for stricter requirements for citizen initiatives? Linda, we'll start with you this time.
Well, as I said, I think that the citizens' initiatives are working the way that they're supposed to. I don't think that we need any changes, and I think the only reason to add restrictions is to make it harder for citizens to have a voice, and I don't see any logic in that. I also don't see any logic in counting a signature on a petition that was signed in Buxton any differently than a signature that was signed in Bangor. They all should count the same, and I think there are no changes needed.
Thank you. Amy, your thoughts on citizen
Sure.
initiative changes? Yeah.
And so I believe that citizens in Maine, whether we have the referendum process or not, do have a voice. The voice is their local legislators. We have House reps and we have senators, and we're intended to be the voice of the people in Augusta. We're intended to do the work. I think there's a perception that those of us who serve in Augusta don't always get the job done, and I can understand that perception. But I also would like people to understand that lawmaking is intended to be a big lift. a bill is intended to go through a really, really rigorous process before it becomes law. And unfortunately, the referendum questions don't go through that same rigorous process. So I would like to see the citizens' initiative changed to the point where there is a representative number of signatures proportionate to the population from around the state, so that it does make it a little bit harder to collect the signatures and get an initiative on the ballot. And then I also feel like once those signatures have been collected, that legislation should be subject to the same scrutiny that every other piece of legislation in the legislature is subjected to. So it should have a public hearing. It should be evaluated by a team of legal minds so that they can look at the legality and the constitutionality of it. And if it doesn't pass muster, perhaps it should be sent out to the people yet again to be validated. So those were the changes that I would like to see made. I think the public is very frustrated by the citizens' referendum process. Maybe not so much this year, but 2 years ago when there were 5 different questions on the ballot. I know when I was talking to people in their dooryards, they were really frustrated with the level of the decisions that they were being asked to make when they felt like it should have been the legislature doing that work.
Thank you. And a final touching on this particular subject in 2 minutes again for this response. So citizens' initiatives are an effective way for regular citizens to directly address an issue related to governance, but if you feel that this method isn't the best, then what would you offer as an alternative? Amy, we'll start with you this time.
Sure.
Yep.
I feel like I kind of answered that.
Right, yeah.
So I definitely think a proportionate number of signatures from around the state should have to be collected. It can be representative by population from each of the 16 counties. Not such a big deal, if you ask me. I think that it should also, as I said, go through the same type of vetting process that any other bill has to go through. And then there would be less frustration on the end after people have voted on this one question that, you know, maybe takes up 1 or 2 lines on a ballot that actually represents perhaps as much as 30 pages of legislation. It'd be less confusion and frustration by the public when that law doesn't immediately get put into effect. And the fact is that it's up to lawmakers to have to make sure after the fact that it meets all of the standards of making sense. I mean, for example, with the marijuana legislation, they didn't even have the right Department of Oversight overseeing the commercialization. So I think there are a lot of issues, but I don't think it's insurmountable. And I think citizens should continue to be able to have a referendum process.
Thank you. And Linda, your thoughts on an alternative or changes to citizen referendums?
Yeah, I'm again not feeling like we need to have changes, but I do feel like the best way for something to be law is to go through the legislative process. I have to agree with Amy on that. I mean, the legislative process is very thorough. Every bill has to come before a committee. It has to pass out of the committee, then both bodies of the legislature, then go through the governor. I think that we have extensive public hearings so that we can really understand the pros and cons. And then we have work sessions where we can work out some of the bugs. So ideally, legislation should go through the legislature. So that said, when the legislature doesn't do their job, and again, I think Medicaid expansion is the perfect example when that didn't happen. 5 times it couldn't get passed, and yet the people voted overwhelmingly for it through a citizen initiative. So I think that we have to allow the people to have their voice, and sometimes the legislature needs to take their direction from the people.
Thank you. Moving on to a different topic, the opioid crisis, which Mainers are certainly no strangers to, nor really any state in the country. It's a scourge that we're dealing with on all levels. How critical is a robust mental health system as part of the strategy to address this problem? And then what are your other ideas about addressing the massive opioid crisis that this country faces, and Maine included? And Linda, we'll start with you this time.
Well, I think the first thing that we have to do with the opioid crisis is recognize that opioid addiction, also known as substance use disorder, is a disease. It is a medical problem, and it needs to be treated as such. We have to be able to understand the root causes, understand what works for prevention and what works for treatment. When the legislature first began addressing opioid addictions, there were a lot of biases and a lot of misunderstanding that led to some bad legislation from my point of view. For instance, methadone was limited to 2 years of treatment, and there's absolutely no science to support that. Narcan, the governor spoke very negatively about Narcan and talked about how it just allowed people to continue to use rather than the way it prevented deaths. So the legislature's come a long way, and I think that this past session they finally passed some really good legislation that we now need to implement. One of those things was a hub and spoke system. It's something that's been used very successfully in Vermont to get people into treatment much more quickly. Drug courts, more money was put into drug courts, which is important. I'm going to keep picking on Medicaid expansion because that's probably the most important thing that we can do. There are so many people that are going to be able to now get the help they need because of Medicaid expansion, so that is critically important. We just continue to need more and more resources for prevention and treatment. I think that those are the points that I wanted to make. Thank you.
Thank you. Amy.
Sure. So substance use disorder is a major, major issue. And Linda's right, we did do quite a bit in this session of the legislature. It's good to hear that acknowledged, especially because we were just talking about the perception that people have that the legislature never gets anything done. The fact is that the vast majority of the work that we do happens in a really bipartisan way, and LD 925 was one of those pieces of legislation. It established the hub and spoke model. There's even a needle exchange in there. It established increased money for medication-assisted treatment, and those are all very, very important. We also passed a pilot program, LD 1231, which helps provide case management to vets in need of mental health care. And then I was actually really pleased to take on a bill that I worked on very passionately, and it was called an Act to Stabilize Vulnerable Families. And it was based upon a treatment model in Portland at Macaulay Residence, which is a residential treatment program, very long-term, very expensive. And I went and visited it, and I asked, why don't we ever hear about this in Augusta? I've served in the legislature for 7 years now, and I've never heard of this program before. And the director said, well, I actually think I talk about it more outside of the state of Maine than I do in the state of Maine. And so I was so impressed with their long-term success rate, which is 80%. That I went back, put in emergency legislation, then invited the Department of Health and Human Services to come and have a tour, come and have a look and talk to the residents, talk to the people who work there, the people who volunteer there, and learn about this program. They were so impressed that they worked with me to find federal funding, so it didn't even have to go through the State Appropriations Committee. And we were able to find over $1 million in federal funding to expand the program in Portland. It'll go from, I believe it's 16 apartments to maybe as many as 20, and also duplicate it in another part of the state. And the exciting part about that is that it provides treatment not just for the mothers or women, but also for the children that are impacted, because again, children are our most precious resource, and kids that have adverse childhood experiences are known to have many, many, many complications later in life as a result.
Thank you. And we're going to touch briefly on campaign finance again before we go to closing comments. Did you want to address something?
Yeah, could I have my extra time now, because I
Yeah,
thought of one other
absolutely.
thing.
So we'll do, I think you have about 25 seconds or so extra time, yeah.
So yesterday in the mail, I got, and Amy might have gotten as well, a report. It's the 2016 Maine Opioid Collaborative recommendations, and it's a follow-up on recommendations that were put in place after this collaboration happened, and great work was done. This comes from the Maine Medical Association, and I think that doctors deserve a shout out. They've been really beaten up on as being part of the cause, and pharmaceutical companies pushing long-acting opioids had a lot to do with that. But just the same, we were overprescribing just hugely. And it's just good news to report that we have led the nation in cutting down on the number of opioid prescriptions that are happening now by about 32%. So I think that we need credit for that good work that was done.
Thank you. And so our last question before we go to closing comments, and again, like I said, we're going to touch on campaign finance one more time. Would you approve of funding limits for state campaigns? Why or why not? And Amy, you'll be leading this one off. Sorry, 1 minute response.
Sure. If we could figure out a way to do that, as well as limiting independent expenditures, but I think from what I understand, it goes against free speech, and until the Supreme Court, reverses its decision, then I don't know that there's a practical way to do that. I mean, you can limit what the candidate spends on their campaign, but it's very challenging to limit what other organizations or other people go out and spend on their own without the candidate's knowledge. So anytime that the Democratic Party or some other affiliate, or the Republican Party or some other affiliate sends a mailer about my opponent or in favor of me, that is not something that we know anything about until it lands in our own mailboxes. So from that perspective, I think that it would be a big challenge to really enforce that limit.
Thank you. Linda, your thoughts on a limit?
I have similar thoughts on that. I think that, yes, we have way too much money going into campaigns, money that could be spent much better on so many other areas, feeding hungry children, something. But I do think that money is considered free speech, and that legally we would have a problem with doing that. I've knocked on about 7,000, maybe not quite 7,000 doors this campaign cycle, and I think that meeting the voters and hearing what they have to say is the most important thing that we can do, and does a whole lot more than all of the mailers and signs that we have and all of the other gilch that we spend money on for campaigning. So I think campaigns need to be about the issues and not about who can spend more money on TV ads.
Thank you. And so we will move to closing comments at this time. We'll start with Linda.
Okay, so I have told many people at the doors that I think Amy and I are both nice ladies, as people like to say. We've actually been able to work together on some issues, and I think we respect each other and what we each bring to the table. But I also think that that's not really the question here. I appreciate the voters making an effort to really understand where we are on the important issues of our time and how we approach solving them. And I hope that tonight you've gotten some insight into that and a better perspective. I want to be able to find common ground and to work towards satisfactory compromise, but I also want to stand strong for policies that simply don't hurt people, policies that help to lift people up rather than to hold them back, and that put profits or that don't put profits for a few ahead of opportunities for many. My priorities are to make healthcare affordable for everyone, to help seniors be able to age in their own homes by keeping property taxes down and prescription prices down, and to fully fund education and our educators such that our children are able to find good paying jobs and that they can stay here in Maine to raise their families and to help grow our economy. So I thank you for being able to come tonight. Thank you all for listening, and by all means, please vote.
Thank you, Linda. And Amy, your closing comments.
Thank you. It's really funny that Linda said that, because I've been saying the same thing. We're both nice ladies, and I think we've both done a lot for our communities, and we're proud of that, and we've both served our state, and we're proud of that. And so this is about issues. I have a record of working with others. My record is very well proven. Some of the topics that we've talked about tonight, housing. So I've led on this issue, particularly in my committee. We stabilized funding for homeless shelters through the Home Fund that Linda referred to earlier. That fund no longer gets rated. That fund now goes to provide a steady stream of funding to our homeless shelters. I also was given an award by the Maine Affordable Housing Coalition for my leadership on affordable housing issues. I stood ready after voting to support Medicaid expansion, or after the voters in my district approved it. I stood ready to work on that issue when we got back to the legislature, ready to look at how other states have implemented Medicaid expansion. And regarding the opioid crisis, I found treatment that worked, and I went to work to ensure that that could be expanded in the state of Maine. I also worked in the committee that I chair to make sure that pharmacists could prescribe Narcan over the counter, so that people could be ready to save a loved one's life in the case of an overdose. I ran for office because a friend once told me that I had a knack for expressing my views without alienating others. And one of the challenges that I most enjoy about working in the legislature is the negotiation of a compromise. We're never going to get everything that we want, nor probably should we. We don't do that for our kids, and it's probably not a good thing for us. But we do need to compromise and work together. And I believe that not only is that something that I enjoy doing, but it's something that I believe I excel at doing. I look forward to continuing to do that for the people of Gorham, Scarborough, and Buxton.
Well, thank you, Amy, and a warm thank you to both candidates this evening for your participation. We encourage all voters to pursue more information about Linda and Amy through other sources or by contacting them individually. And if you're not able to vote on Election Day, you may call or visit the clerk's office to get an absentee ballot until Thursday, November 1st. The clerk's office will be open until 7 o'clock on that evening. Now, early voting can also be completed at the Municipal Center from October 29th to November 1st. And in Maine, you may also register to vote on Election Day at your polling location. Information will follow on voting locations, town business hours, and where you can get more information. On behalf of everyone at Gorham Government Education Television, I'm Beth Sanborn, reminding you to please get out and vote on Tuesday, November 6th. Thank you, everyone, and good night. Thank you.
Happy to have that behind me.
Yeah, really.